Facelift. It's a very commonly used term for invasive or surgical and non-invasive or non-surgical procedures to rejuvenate the face. But what is facelift really? Is it non-surgical or surgical, or is it all? Let's understand in this video. So when we talk about facelift, it is generally a very commonly used term for all procedures that usually target or rejuvenate the face. But when we talk about a classical facelift, the procedure facelift, scientifically it's also called rightedectomy. That means cutting off the wrinkles. Righted is wrinkle and ectomy is removing. So obviously removing the wrinkles is what a facelift is all about. But technically and classically, it is not a non-surgical procedure. Of course, there are many practitioners who use this term for thread lifts, for lifts by fillers or liquid facelift, but in general, the classical facelift is a surgical procedure. Now, once we've understood that, let us understand what is a classical facelift and what areas of the face it targets. The most common problem in the aging face are the nasolabial folds or the laugh lines, which are deepened with age. Then comes the marionette lines, or these folds at the lower part of the mouth. And of course, the sagging area of the jawline or the jowls, the neck, and all these combined give the face a more squarish look, from a triangle of the youth to a square of the aging face. And this is exactly what we intend to correct with our facelift surgeries. What do we do in the facelift surgeries? Now, in the facelift surgery, basically, it is from the mid face to the lower face that we target, and of course the neck also. So face and neck lift, ideally it's done together, and it can give a very transformational look to the aging face. So how do we approach the face? Generally patients are very worried about that. Doctor, hope that the look is not very artificial after I get a facelift. I hope I'll not look very pulled. So we have to understand how facelift was started and then how evolution has happened in this surgery. In the earlier years, that means I'm talking of decades back, surgeons started doing facelift by simply excising the skin or removing the skin and tightening the face. But then the results did not last as long and did not look as natural as they should have. So gradually evolution happened in this surgical procedure also. And we started doing a little more tightening in the tissues underneath the skin. And now what we've evolved to is a very nuanced procedure. It's called the deep plane facelift. And what we do in this procedure is that we tighten the smarce layer, which is the deeper layer under the skin, which is actually sagging. And that layer, once tightened, it lifts the entire middle portion over here. So it lifts the nasolabial folds, it lifts the cheek area, so cheek looks more contoured. It lifts the angle of mouth, lifts the marionette folds, this tissue underneath your chin or the submental area or the double chin area that we call. Then again, the neck area also is lifted in a deep plane face and neck lift. So obviously, it's a comprehensive procedure. And however much we try, if we are wanting to compare the longevity and the effect of any procedure vis-a-vis this procedure will win hands down because of the long-lasting benefit and the extreme transformations and natural transformations that it gives to the seeker. Now, when we are wanting to understand a little more technical detail about the surgery so the second most important question is, first I already discussed that, doctor, I hope that I will not look artificial. The second is the anesthesia process. We do this surgery under IV sedation with local anesthesia. The patient is comfortable breathing on his or her own, and the case takes roughly about 4 to 5 hours. Generally, the recovery is not very prolonged. I'll come to that a little later. Talking about the procedure itself, the approach to a facelift can be from inside the hair or from in front of the hair. And then the scar or the incision travels around the ear and back of the ear and vanishes into the hairline. It is literally inconspicuous. If you look at the scars following the facelift surgery, they heal very beautifully most of the time. In case the scars tend to be hypertrophied, you can always seek more treatments to have the scars settled. But in general, this is not a big problem if the scar line or the suture line is not under tension. And that is why what we do is the skin excision is just enough so that the skin is not too tight. But what is tight are the deeper tissues, and that is what is giving you the more natural effect from the deep plane face and neck lift. Let's talk about the recovery now. So in general, what I tell to all my patients is 15 days to look presentable and 2 months to look very good. So sometimes patients have a very short timeline, or they are on a deadline, the doctor, we have this function or an event and we really need to look our best. So can I do a facelift? So well, if you understand it like this, that in about 6 weeks time, you start looking very natural from your facelift surgery. But you still look presentable after 15 days, may not be your best yet. So that is how you should plan for this surgery well in advance so that your recovery is taken care of. However, if you've already done fillers earlier or threads earlier and you are into non-invasive procedures, now you have stopped getting results from them or you're tired of doing them, then you can always switch to a facelift surgery. In this case, what you need to do is you need to go to the surgeon and tell all your past history about all the treatments that you've done, when you've done, so that an appropriate treatment plan can be made for you, because your plan will be different than a patient who has not done any procedure. Last and most important question, how long will the results last? Whether the results are permanent or not. Well, as the very famous saying goes, nothing in life is permanent. But yes, the result that you get from this surgery is going to make you look several years younger or more rejuvenated for your age. This result that you get of rejuvenation is nearly permanent. But yes, you continue to age. So every other day, you will be a day older. And if you want to maintain your results as they are, then you may need small additional little procedures, maybe filler or fat injections to maintain. But in general, usually we see patients coming back for a retouch or maybe something to do after a facelift, typically few years later or not immediately. But again, here there is also a catch. If at the starting point you were very loose or lax in your skin, then fat grafting is to be done with the facelift surgery, that we liberally do during the facelift surgery also. But typically in these patients, I will tell them that you come back for a fat grafting, which can be a more comprehensive fat grafting about a year, maybe 8 months to a year later. And that is going to give you the best results. The fat grafting is generally just injections, and it is a very minor procedure when we compare it to a facelift surgery. Now, when we talk about treating such faces, we have to see the volume loss versus the sagging. So a balance between lifting and filling needs to be achieved, and that an expert in facelift surgery can definitely tell you how to go about it in the best possible manner. When we talk about revision surgeries after your facelift, so patients who have had facelift surgeries done in the younger age, and that's another question that I will just now answer. In the younger age, if you're getting your facelift surgeries done, then obviously you are more likely to need a touch-up or maybe some procedures a few years down the line if you want to keep looking your best. Now, when we talk about the age factor, how young is too young for a facelift surgery? Well, I would say that after 18, if your sagging face bothers you, which generally happens in such a young age after weight loss, or some people are genetically predispositioned to have laxity very early on in life, then you can even opt for a facelift surgery earlier. Now, why facelift and why not other non-invasive procedures? Some patients say that, doctor, I'm still too young for a facelift. Well, if you think about rejuvenation and if you have to start young due to some reason, then you have to also understand that if you're opting for non-invasive procedures, then they will also need to be done ever so frequently. So obviously, if you are younger and you are having laxity issues in the face, then obviously facelift is a better solution for you because it will need less maintenance when we look at other procedures like the non-invasive procedures. So I hope that with this video I've been able to answer a few of the commonly asked questions about facelift surgery. And if you have more questions, do write them in the comment box below. I'll be very happy to answer them. We keep doing regular live sessions. I'll also be doing a live on facelift surgery soon. And we have various results posted on our different social media handles on Instagram. And the handle is by the name of DRSB Aesthetics. Even on our channel, we have facelift videos with results, and you can take a look at them. And you can reach us on the numbers that will be given in the description box below. Thank you for watching.